So Renee's breaking down the numbers, so let's go ahead and talk to somebody who is actually in the trenches with this, how hospitals stand with COVID-19. Dr. Ross Goldberg, as he does every Friday, joins us. He's the president of the Arizona Medical Association and District Medical Group Vice Chair of Surgery at Valleywise Health. So Dr. Goldberg, great seeing you again. Thank you for being with us. So we did see yesterday a higher number of cases, and we're also seeing hospitalizations tick up. What are you seeing in our hospitals?
Well, good morning as always. Always a pleasure to be on. Yeah, it's the slight increase we're seeing in the hospitalizations, and we're being cautious. We're watching everything and we're prepared for any jumping cases.
So when we see these numbers go up in hospitals, tell us exactly how that impacts you. Now, this is not, I mean, you still have beds and things, and put it in perspective for our viewers as to where we were, say, in July and early August compared to now.
Well, we still have a COVID unit. We've never shut that down. The thing that's different now than, say, July, we had multiple COVID units and multiple patients in them. We've been able to maintain a single unit because we don't maintain the numbers, and we want to make sure we keep that single unit as we take care of other patients. The concern is if that COVID spikes again, we'll go back to where we are in July, which we don't want to happen.
What do you think is behind, I mean, maybe it's just, it'd be a theory at this point. What is behind this recent rise in cases, you think?
Well, if you look at the East Coast, it's turning to turn to fall and winter. It's colder out. You're spending more times indoors, more closed spaces, higher chance of transmission. We're fortunate here, we can still go outside, but it doesn't mean we're not at risk.
How much of an impact do you think the opening of schools is having on this?
It's been different in different places. I think if we maintain keeping an eye on the numbers, preparing to react if there's a spike, and then being proactive, we can still keep on moving towards that normal way of life.
What's the morale like in hospitals? I know for a time, so many of our medical workers were so overworked and stressed and upset with what they were seeing. How's it going now?
It's going well. We're back to our normal busy day-to-day activities, and we're just watching everything going on, and we're just prepared for anything that could have come our way.
So you have one COVID unit now in your hospital, and you said you used to have multiple COVID units. How is that impacting day-to-day operations at the hospital with, say, you know, hip replacements and elective type surgeries?
Well, we're doing elective surgeries. You should still come to the hospital if you have medical problems. We are seeing everyone and anything, and we're just being cautious. But we are up and running like normal activities.
Overall, if you had to communicate to the viewers this morning, are things getting better? Are they getting worse? Are they staying the same? Where are we as we stand with COVID here in the Valley?
We're cautiously optimistic, but it's not any time to stop what we're doing. I know it's been a long haul. I know it's tiring, but we have to keep on doing the same thing I preach every week. Wear a mask, social distance, wash your hands, and get a flu shot.
Right. I think I'm going to do that right after the show today, as a matter of fact. And one more question, and I'm sorry, it's a little bit off topic, but it's very important. If you, Dr. Goldberg, were handed a sucker with a scorpion in it, and you made a bet with colleagues that you would lick that sucker down and then eat the scorpion inside, if a patient brought that to you, what would you say to the patient? Would you say, yes, go ahead and eat the scorpion, or would you advise against it?
Well, I've seen those lollipops you're talking about. I think it's a bad business plan to sell things that would kill people, so I'm pretty sure it'd be okay.
Okay, so it's not alive. Is there any inherent risk to ingesting a dead scorpion?
I am not aware of. I'm not a toxicologist, but again, I don't think they would sell them if it was dangerous. I just don't think that would work out well.
All right, you heard it. Dr. Goldberg is recommending, Corey, that you be the first one to eat the scorpion. Great talking with you, Dr. Goldberg. Thank you again for all you're doing in the community. I appreciate it. Well, there you go, Celeste. I mean, doctor's orders. Corey has to eat that scorpion.